stomas, right? Not every stoma is the same, okay? And then there's 3 different kinds. So you have ileostomies, you have colostomies, okay? And then you have urostomies. So a urostomy is for urine, okay? A colostomy is the attachment from the colon, and an ileostomy is from the ileus, or the ileum, which is part of the small intestine, okay? So, okay, so like I said, not all are the same. So one of the most important parts of taking care of someone's stoma or helping them change their appliance is measuring the stoma, okay? Typically, if someone is post-op, the stoma has to be measured for like 8 weeks. Okay, the first 8 weeks, you should measure the stoma every single time you change the bag. If you have a patient who's had their ostomy for a long time, 5, 10, 22 years, odds are they don't need to do any measuring because they've got it down pat. So when you're measuring the stoma,
So it's for the first, how long?
8 weeks, so
8
for
weeks.
the first 2 months, 2 months. So when you're measuring the stoma, actually I'm gonna measure with this small one, okay? And now if you don't have a measuring tool, because a lot of the units don't have them, you can guesstimate, but the best is to measure, okay? So here's our stoma, right? So look at this. This is way too big, okay? Huge. This puts all of this skin at risk for breakdown, okay? So when you're measuring a stoma, you want to measure quite close. You want about 1/8 of an inch of skin visible. So this is still way too big. Let's see. That's too big. We're getting there. That looks just about perfect, okay? You got some wiggle room, okay? So this little stoma here, we're looking at 1 3/8 inch. Does everybody agree?
Yes.
Yeah, okay, cool. Okay, so we've measured. Now we're gonna take our measurement, okay? And we're gonna put it on the back of our wafer, okay? Which are occasionally pre-marcated, okay? And I want everybody to do this, so you're gonna do this. You can use the oval stoma if you'd like to try the oval stoma. And I'll show you, we'll work through that. Honestly, that looks good for the oval stoma. So if you're using the oval stoma, you want to use the last one there, okay? So then you're going to take your pen and you're going to trace your cutout, okay? So we're going to trace the 1 3/8 inch around, okay? And you can use pen for this, you can use Sharpie for this. This part is not going on the patient's skin. Okay, it's just so that you can cut it out. Okay. Oh, Lila, this is yours.
We only have one.
Oh, I'll get you a bag, that's mine. Yes, that one's for you, and I can get you a bag. So, you're gonna trace your 1 3/8 right onto there. Yes, ma'am.
Should we open that one? You want to use this too?
No, you don't have to do that one. Nope. So there are 1 pieces and there are 2 pieces,
Okay,
okay?
I got you.
Yeah, so what you're working with, Nanette, is a 1 piece. You know, the wafer and the bag is connected.
Yep.
Versus Lila has a 2 piece.
Yep.
Senka has a 1 piece. I'm sorry, I don't.
Kelly.
Kelly has a 2 piece.
Bridget.
Bridget in the back there has a 1 piece. Okay? And you two should have, you have a 2 piece. What are you working with over there, my dear?
The 2 piece.
That's a 1 piece.
Sorry.
That's a 1 piece. So why do we have both? So the 1 piece is good for our patients who have arthritis. Okay, because snapping the bag and the wafer together with a 2 piece is hard for, our patients who don't have very good dexterity. Okay, so that is kind of how you judge which one goes on who. And it's all personal preference. If it was me, I would want a 2 piece because you can take the bag off, you can wash the bag. I wouldn't want to wear something like this for like 3 or 4 days. So you change the bag, the wafer, the appliance, you change it twice a week. Okay? Okay, moving on. So now we can cut out our tracing.
Oh, I got the scissors. Oh, yeah.
Yes, so there's only one pair of scissors per table, and Bridget is going to need to use someone.
Everything. You can steal my stuff.
So did you measure out and trace it out?
You even cut it.
So the scissors are round.
Yeah.
Don't
See, I'll
worry.
show you Nanette. Let me
Don't
show you.
worry, it's okay.
Yeah, I got it.
You got it?
Yeah,
All right.
it's curved.
It's curved so that
Yeah.
you can cut a nice circle.
Yeah.
Which is something also to talk about. Prior to, actually that part doesn't matter. What does matter though is that what you're cutting out right now is wax, okay? It's like caulk. All of this stuff is like caulk.
Yeah, it's
Um,
not even.
It's like wax, so if you have to use a normal scissor and you get a rough cut, that's okay, okay? It's not gonna tear up the stoma. The wax is going to melt and it's going to adhere to the skin, okay? When wax melts, is it sharp and pointy? No. So if you have to use a normal scissor because you don't have the stoma scissors available to you, by all means, use a normal scissor. If you don't have a measurer, start with the smallest measurement, okay? Hold it up to the stoma. If you need to make it a little bigger, cut out a little more. Hold it up to the stoma. If you need to make it a little bigger, cut out a little more. It's better to start small and work your way up than to cut something way too big. Oh, don't stick it on yet. I didn't. Okay, yeah. Okay, so now we're gonna do something called crusting. Okay, so to crust a stoma, you're gonna take your stoma powder, okay, which you should all have at your desks. Can somebody oh, Bridget is using scissors. We'll give a second for Bridget to finish cutting so she can pay attention. No worries, no hurry. Where did I put my phone? All
Are
right,
you stealing that?
we're sharing.
I know,
We're
I'm
waiting
only
for the
getting
next
hand hurt.
Waiting for the next steps. They really have
Oh yeah,
stomas that size? Oh my gosh.
yeah. You'd be surprised.
Oh.
Really? Okay, so now you're gonna take your stoma powder, okay? Before you do this, watch me do it, and then we'll try, okay? Just because this can get quite messy. So I'm gonna take my stoma powder, and I'm going to squirt it around my stoma. Now, I'm gonna try and flip this up so you guys can see it. Okay, see how close I am to the stoma? Okay, you don't want it to be big and all over the place because it's gonna mess with the adherence. So then what I'm gonna do is I'm gonna take my hand, my finger, and I'm gonna kind of rub it around, okay? And flatten it out, but I don't wanna spread it, okay? So it should be within the first couple, like a 1/4 inch of the stoma. If it's a little more, that's fine. So I'm gonna take my powder now that's on my stoma. Also, you're putting it on the skin around the stoma. It's fine to get it on the stoma. So many people are like, oh, I got it on the stoma, is that bad? Like, we wouldn't be giving you a product to buy something that shouldn't be on it. It's fine. Then you're gonna take your skin prep, okay? And you're gonna bounce it or blot it on the stoma powder. So what this is doing is it's creating a crust, which is why this is called crusting. Okay, don't wipe, because if you wipe, you're gonna wipe it right off. Then I'm gonna take my skin prep and I'm gonna stick it back in its package because there's still skin prep in there we can use. And now we're gonna let it dry. So go ahead, sprinkle your powder. Okay, so with the powder, you don't want to touch it to the skin, you don't want to touch it to the stoma, and when I say that, I mean the tip, because the tip will get clogged. Okay, so it just has to be like a nice little squirt.
How'd you do yours so nice and even?
Well, you didn't know Nanette's had a stoma.
Oh.
I'm just kidding.
I know somebody that does.
Well, there you go.
Practice, I guess.
I'm just doing this to make it,
This will never come off.
to demonstrate the point later.
Oh, okay, that's it.
How's it going? Good?
Oh, good.
Good, I'm gonna have you do that step twice. Okay, so let it dry, you can even fan it to help it dry, and then do the step again. So what you're creating is a crust here that's gonna protect the skin if it leaks.
Oh, that's pretty cool.
Yeah.
Yeah, it is.
So we're gonna do another one right around what we
We'll
already
do
done?
the same thing, yep.
Mine doesn't look pretty.
It doesn't have to look pretty. Kelly, this is for poop and pee.
You know, I'm a perfectionist.
So am I, apparently. All right, so yeah, go through that, do that twice, okay?
So does this make like a sealant?
No, so it makes a protective crust.
Okay.
So you're just basically, oh, that was stupid.
What do you need?
Nothing. We're good. You're just basically protecting that skin. So it's kind of like, I'm trying to think of something that's crusty and protective.
Scab.
It's like a scab. Yes.
Yeah.
Thank you. What a great thought. It is like a scab. Okay, so after you do the crusting and you let it dry, you can use that same skin prep all over the skin, okay? Or in the area around the stoma.
So I
Because-
dab it again.
Yes, ma'am, you blot it again
Sorry.
until it turns, it gets wet. On the skin, it'll turn clear and translucent. So now when you're done with that, you're gonna let it dry. And then you're going to peel the plastic backing off of your wafer. And you're going to leave the white angel wings on because those are gonna be what helps you hold it to put it on.
Can we put it on? Or?
Yeah, do it, girl.
I think I need to cut mine more.
Okay.
Okay. It looks rough.
That's okay.
I just don't want it to hurt the stoma or rub against it. or
No,
poke into
yeah,
it.
Kelly, so I talked about that for just a second, but we can talk about it again. It's wax. It's gonna melt,
Okay.
okay?
It doesn't really have to.
It doesn't have to be the most smooth, beautiful, perfect circular line,
Okay.
okay?
She said stick it on.
Yep. Stick it on, and then you peel the angel wings off after you stick it
Too
on.
fast, Lila. You just gotta pay attention.
Oh, yeah, I'm looking at it still not.
Okay, so now we're gonna talk about paste and e-conceal, okay? So a lot of people call this a stoma ring. Oh, the stoma ring, oh, the stoma ring, oh, the stoma ring. No, okay, this doesn't have to be used on every single stoma, okay? And then the paste. This also doesn't have to be used on every single stoma. So what we just applied, like I said before, is wax. Okay, so this is gonna melt to the skin. So after you put the bag on, okay? And if you're using a two-piece, this is now when you snap the bag on. So you wanna hear it snap. Yep,
Tupperware.
Couple
I always tell
snaps.
myself Tupperware.
like Tupperware. Jillian ruined Tupperware for lots of people. Just kidding. Yeah, we had a lady who was like, oh my God, you ruined Tupperware for me. Okay. Sounds like you had a couple other issues, honey.
Using the bag.
Yeah, yeah. Yep, so make sure it's good and snapped on. Okay. And then you're gonna have your patient hold their hand over the wax for 5 to 15 minutes because that's gonna melt the wax and help it adhere to the skin. This is like the most important part, is the adherence. Otherwise, it's not gonna do well, okay?
Right.
So hold the hand over the bag. So, now we're gonna talk about paste and E-Conceal. So, here I have a stoma that I created, so we're gonna use our imagination, okay? So this stoma is beautiful, it's perfect, it pops out, there's no creases, there's no convexities, okay? I'm gonna come around and show you this stoma. So if you see here, okay, so use your imagination, all right? This is the skin, this is the stoma, okay? So do you see how part of the stoma isn't even flush here?
Yes.
See how it sticks out here? And then we've got a couple creases here and here from our fat rolls, okay? See how it's not level, right? Okay? See how the stoma is kind of flush here and not over here, okay? I'm gonna come show you too. See how the stoma is kind of flush with the skin and then it sticks out here, okay? Flush with the skin, sticks out here. Okay, so quite often it'll look like this. So let's say we're doing this. So what do we do then? Okay, so this is gonna be a problem. This is gonna cause leaking, okay? Because if we put a flat bag on, it's not gonna be level, okay? You need a level playing field to be able to prevent leakage. So, this is when you use your E-Conceal, okay? This is when you use this stoma ring. All right, so what I'm gonna do is cut this in half, okay? And what I wanna use it for is to build up the skin so that we have a level playing field for our patient. So this is like also wax, okay? We use lots of wax. This is like wax. So I'm going to, I can stretch it out. You guys can open yours, maybe open one per table so that they can use one next time. And then I'm gonna put it underneath my stoma where it's not equal with the top. Okay, does everybody see what I'm doing?
I don't have one.
You don't have one? Okay.
Here you go, Bridget.
All right, yeah, get it out, play with the putty.
Could we get yours, Kelly? Because we don't have one.
Oh, yeah.
Perfect.
Can I toss it?
I'm sorry, guys, I thought I gave everybody 2.
Okay, so as you can see, I still haven't built the skin up enough to be level, right? Okay, it's
Right.
still not even.
Lower.
Do we see this? Do you need me to get closer? Okay. See how it's still not even built up enough, okay? Right? So I can use more E-Conceal. I can use more of this wax to stick on top, okay? So I can stretch it out and put it on top. Oh, well, we were going like this.
Shoot. Yeah, he's stronger than
Okay, there we go. I have now leveled the playing field and we can put an appliance on top there. But, so we're gonna pretend this here is like a skin fold, okay? Because we all have that line across our stomachs and odds are the stoma is here and the crease is here. Okay, can you see my roll here? Okay, so we're gonna pretend this is a roll here. So this works great in the rolls. Okay, so this is the paste. And this is legitimately just like caulk. It even comes out like it. Okay, so I'm gonna take this and I'm gonna put a bead of paste in my roll here. Okay?
Okay.
So I fill that crease in, okay? And if there was a roll over here, I could do the same. Just put a nice, thick nice thick squeeze of paste in those areas, and then I can put my appliance right on top, okay? And then this definitely needs to be held for at least 10 to 15 minutes because look at all this wax, right? We want that to melt. We want this to stick, okay?
So every time that all gets changed, you have to do all the whole process again?
Yeah.
Yes, you do.
Okay.
And like I said, you wanna do that twice a week. And so let's talk about emptying the contents, if you will. Yes. So it doesn't pull off of the skin, okay? We want you to empty it around this Hollister, this this word here, okay? That seems like, oh, well, that's a lot. Oh, yours is
Yes,
lower, Lila.
I get it though.
Yeah, so we usually say about 1/3 of the way full, okay? And so many of my patients have told me, you know, like, oh, they say it's not full enough yet. Oh, they say it's not full enough yet. Oh, they don't want to empty it yet. Empty the bag. Also, let them empty it. Supervise it, okay? Because these patients, they're going to need your support. They're going to need a lot of direction, a lot of hands-on care, a lot of love, okay? These are patients who, you know, have colon cancer, so they're going through a lot. It's going to be hard for them to remember what they've been taught on how to take care of this. You know, you guys are going to be their guides. You guys are their saviors, for lack of a better word, okay? Also, when you have a colostomy or an ileostomy, this bag is a pain in the butt, right? It's a pain in the butt to separate. It's going to be hard to get the stool out. The trick is,
Especially when you got gloves on.
yeah, when you're putting on a new bag, okay, you're going to fold it and pinch it so that you have a spout, okay? Yep, you just make a spout for yourself, so it's easier to empty. And then when you're,
It's all yucky in there.
yeah, it gets all yucky. Use a baby wipe, a washcloth, and just wipe it out. You can clean that whole area so that it doesn't get yucky when you're rolling it back up.
Right.
Speaking of yucky, so sometimes our patients who have these bags have to do colon preps, okay? And that can be a lot in this little tiny bag. I don't know if you've ever done a colon prep, but it is a disaster.
It is.
Let me tell you.
It is.
Can I steal this? So one of our tricks of the trade, if you will, for the colon prep is to put the patient who has a colostomy or an ileostomy in the urostomy bag, okay? Because their stool is gonna be liquid. I mean, it's just gonna squirt right out of them. So you can put them in the urinary bag, okay? And then they have these adapters at distribution. Some of your units have them. Some people, you can use them for like Foley catheters to extend them, whatever. This will snap right on, okay, and attach. And then you can attach this to a Foley bag. And that's how you deal with your patient who has a colon prep. Beautiful, isn't it?
Yeah.
So this can also be put on, like I said, the urostomy bag. So if you have a patient with a high output flow, high output bag, you can put this connector on and attach them to a Foley bag, okay? To help, you know, contain the drainage. What else? Yes,
I've had many patients who like to reuse these bags.
yeah,
And that's okay?
that's fine.
Okay.
So they can't reuse the one piece,
Mhm.
but this bag is totally reusable. So unfortunately, our insurance companies don't cover, you know, a different bag for every single day, right? So yeah, these bags can absolutely be washed and reapplied. Washed and reapplied. So a great cleaning tool is vinegar, but if they're in the hospital, you can use soap, obviously, as long as it gets dry. Your patients who have these appliances, they can shower with their bag on. So they can have the bag and the wafer on and get into the shower. This should be fine, okay? Or they can take it off and shower. I mean, who doesn't pee in the shower, right? However, when they're done in the shower, you just want to make sure that they dry this off, okay? Because we want this to stay stuck. Okay.
All right.